Good afternoon, everyone. Thank you so much for showing up. My name is Ria Jain. I am the recruitment advisor at SIUK, and I primarily deal with UCL applications. I have also graduated from UCL last year with a degree in competition law. So today it gives me immense pleasure to introduce Professor Nora Colton. She is the director of the UCL Global Business School of Health. She is a health and development economist with extensive experience in change management and strategy. Previous to this role, she was the UCL Pro-Vice Provost and Joint Director of Education at the UCL Institute of Ophthalmology and Moorfields Eye Hospital. She has been a professor of international economics at Drew University, USA, Dean of Business and Deputy Vice Chancellor at University of East London, and a visiting professor in the School of Public Administration at the University of Electronic Science and Technology, Chengdu, China, as well as the American University in Beirut, Lebanon. She holds a doctorate from University of Oxford and has also studied and taught at a number of leading universities, including Harvard University, W.P. Carey School of Business at Arizona State University, American University in Cairo, American University in Beirut, and Barcelona Business School at University Pompeu Fabra, Spain. She also holds a certificate in change management from Cornell University in the USA. Professor Colton has also been the recipient of a Serial Fulbright and a Carnegie Foundation grant to conduct fieldwork in the Middle East. She is the author of numerous journal articles concerned with Middle Eastern economics and politics. She is also a co-author of a book with Elsevier Press entitled Middle East Finance, Missed Opportunities or Future Prospects, and has a book forthcoming with Palgrave Macmillan on the political economy of Yemen. She has also been a series editor of a book series on Middle East economics through Palgrave Macmillan. More recently, she conducts research and publishes on healthcare management and strategic leadership. She has a particular interest in change management as it relates to the healthcare sector and has designed programs and taught on healthcare management, postgraduate degree programs, as well as health-related executive education and training programs. Professor Colton, the screen is yours.
All right. Well, thank you so much, Ria. It's really a pleasure to be here and to have the opportunity to talk about the Global Business School of Health, and particularly our MBA Health. So just bear with me 1 minute, and I'm going to share my screen. So I hope you can see my screen, and I'll start my presentation, and then hopefully that will also stimulate some questions. And so we'll have some time at the end for a Q&A. So first of all, I want to just tell you a little bit about our school and who we are. So of course, I'm sure many of you know about UCL, and you know, of course, it's a 8th in the world. But we're also exceptionally well known for our work in population and public health. And in fact, our faculty of population health was ranked 4th. So within that faculty, we've created the first business school in the world totally dedicated to business education as it relates to healthcare management. Because we live in a particular time, and as many of you know, with the pandemic, there's lots going on. and it requires really exceptional leaders and managers in healthcare management. So this area is an area that's growing rapidly. It's something that spans consultancy organizations like PwC, Deloitte, KPMG. All of these consultant firms spend a lot of time these days helping organizations, not just in the healthcare space, but also align with the healthcare space to really think about how to manage, create pathways, processes, to really redesign our healthcare systems. So the professionalization of healthcare requires a different view. It requires really a view from business and management. So that's really what we do at the UCL Global Business School for Health. We really work with our students and our stakeholders to reimagine global healthcare in a very different way. We need solutions that don't just tinker at the edges of what we have. We need to really be able to rethink, be innovative, creative in terms of how we approach healthcare management. And so this particular program that I'm going to talk to you about today is really about taking that kind of ethos and thinking forward. So many times I have students ask me, why would I do an MBA in health versus a general MBA to work in health and healthcare? Well, we've interviewed hundreds of leaders really over the last year in this space. And they constantly tell us that a general MBA is just not good enough anymore for really the challenges, the complexity, the nuances that exist in healthcare. They need something really much more focused on their industry. So there might be some programs out there that have a little bit of healthcare at the end and give you a general MBA with a bit of healthcare. We've designed something much more innovative because we have really listened to the sector. We've listened to those leaders. We've listened to those CEOs in healthcare, and they are looking for the next generation to be able to really understand business and management, but with a real healthcare focus. And there's many reasons why that's so important, because the health sector is not just like other sectors. It really gets into a very different space. If you think about healthcare, each health system around the world and the way healthcare is governed and the way that we have the kind of partnerships between private healthcare and public healthcare really create a very different, much more nuanced kind of business model than we'd find in other sectors. So we need leaders who really understand that space. They understand healthcare, they understand hospitals, they understand GP practices. And so together with a very diverse group of people who are interested in health and healthcare, we would like you to take your education to the next level. So the other question I often get is, why would I do an MBA rather than an MSc? Well, because MBAs are really very specialized in giving you that kind of breadth as well as depth in terms of business and management. So it opens up a lot of career opportunities that you wouldn't get in a specialized master's, even one in healthcare management. It also will build your confidence and accelerate your career in a way you can't even understand at this moment. It's really a transformational experience, and the potential to really build your portfolio, pivot your career. So the one thing about an MBA is you don't have to have prior knowledge of healthcare. You can pivot in from almost any background into an MBA, even an MBA in health. So that really opens up the opportunity for you to have a much wider view and go into a sector that maybe you did your undergraduate in business and management. Maybe you did it in social sciences. Maybe you did it in the humanities. You can also have done it in medicine. You can also come in from a science background. So the diversity of people on this MBA is quite wide, but the string that really pulls everyone together is that real interest in health and healthcare. So it's really an opportunity for you to kind of fast forward your career into a growing sector that will continue to grow. There are many reasons why healthcare And it's not just the pandemic. We see a rise in non-communicable diseases. We see that across the world, we have aging populations. And even places like India, which currently has a very young population that's very large, that population will age. And so, and then last but not least, we all know that climate and climate change is impacting people's health in a way we could never have understood just 10 years ago. So when you pull all that together, trust me, healthcare and health will be the areas that will continue to grow. And even in general MBAs, health and healthcare comes up fourth on the list. Recently there was an article that demonstrated that in places like the United States, people are making up to 150 grand coming out of their MBAs in the health sector. So when you think about getting an MBA, it's like going to a boot camp. It's a training, and this one in particular, you're going to see it's fully loaded with all sorts of opportunities. It's 12 months, but it's going to be the most intense 12-month experience that you've ever had in your life. And it will be the most rewarding 12 months. It's a real opportunity to invest in yourself, to invest in your future, and to invest in your career. So when should you start? Well, this MBA is an in-person MBA. So early in your career is a great time. But also if you're more mid-career, it's an opportunity to really reboot yourself. But for those of you who are really starting out, it's an opportunity early on in your career to gain those skills, to get that extra kind of lift that will be so important. And of course, why UCL? As I already mentioned to you, UCL is 8th in the world. It's first in research in the UK. But most of that research is truly in health, medicine, and life sciences. So this MBA program not only builds on the best in terms of experts in business and management, but we bring in our colleagues across UCL. It's extremely interdisciplinary so that you get really a cross-section of experts coming together to really give you an exceptional experience. So what makes our program so unique and stand out from other even MBAs in healthcare or MSCs in healthcare? Well, first of all, as I just said, we really understand the healthcare sector. Health is not an afterthought in this program. It's built in from day one. It is all your case studies. As you move through the program, you'll not only gain more competencies in terms of business and management and leadership, but really an in-depth, sophisticated understanding of the healthcare sector from healthcare leaders who are really cutting edge, who are really defining that space. We have a number of exceptional industry individuals that will come in and work with you. We have a program called Executives in Residence. That's 25 CEOs and former CEOs in the healthcare space who will be offering office hours throughout your MBA where you can meet with them. They can give you career advice. They can counsel you. They can help you as you move forward. And it's important. You might want to stay on in the UK and do post-study work. So those connections you'll make in this program will be integral for getting the kinds of jobs and opportunities that you're looking for. We take the career aspect as a very important part of why you'd want to do this MBA. So from the very beginning, we have a recruitment agency that will be working with us to help evaluate and work with you to make sure you get what you need out of this program, to help you visualize where you want to go afterwards. And as you work through the projects, that'll be integral as well. And then of course, last but not least, it's the whole alumni opportunity that you're going to get back by engaging with us, and also opportunities to be a lifelong learner and to engage with our executive education and online courses so that you stay relevant as you move forward in this exciting industry. So what's the typical profile of the kind of person that we'd imagine coming on to this program? We're looking for people early, or as I said, mid-career, good academic or clinical backgrounds with work experience, either alongside training or full-time, ambitious and determined. Your attitude, your potential is going to be integral to us. And we're looking also to build on people who have already had healthcare management experience or experience in pharmaceuticals or biotechnology or consultancy. We're really looking for people who understand this opportunity, who have an eye on accelerating their career and want to gain those networks, not just nationally, but internationally. Because one of the things about this program is that it will bring a group of people from across the globe together. And those people that you will meet and network with in your MBA, those will be lifetime connections that will really make a difference. So what are some of the career destinations that we expect from people out of this MBA? Well, things like health consultancy, as I just mentioned to you. Health consultancy is a huge area and it's growing internationally. Many health systems, many public health officials, hospitals feel overwhelmed with all the change that's coming at them. So they really look to some of the big consultancy firms like PwC, Deloitte, KPMG, EY, McKinsey, Boston Consultant Group to come in and help them find solutions. We're going to be working with people from those consultancy firms through our projects, and hopefully those will be some of the places that you might aim to work for after you finish this MBA. There's also huge opportunities in pharma, biotech, and public and private health spaces, as I just mentioned. And those are growing also at an exponential rate as we see digital health take on a bigger and more prominent role. And in terms of pharma, there's many companies that are looking for people with business skills, not just with science skills to really lead. There's also health tech and med tech startups, which is a huge space. And then legislation and policy roles, as well as academic roles. So there's endless opportunities of what you can do with this MBA in health. So now I just want to turn and talk to you more specifically about the program itself, how we designed it. We really designed this program to be a program, as I said, for people who have a real interest in health and healthcare, but come from lots of different backgrounds and who want to go on to different kinds of destinations. It can be the public, the private, maybe even you want to go into the charity space. That all is possible through this MBA. So the program really blends world-class academics with business professionals. So all of the modules, as you'll see, I'll talk more about that in just a minute, are taught in a way that you get a team. They're not taught by individuals, they're taught by groups who really bring expertise, both from the business and managed academic side, both from the practical side, but also from the health side, both in terms of the academics and also from the practical. And healthcare now accounts for about 10% of GDP in most countries. In places like the United States, it's up towards 20%. So this is such a growing area that we feel that we need a diverse group of people teaching on this program so that they can bring those perspectives. And at the end of the day, it's really about improving lives. We want people who are passionate, who really want to make a difference, improving patients' outcomes, bringing innovation in healthcare settings, and championing universal healthcare. Those are all the kind of ethos that are so important to us and that we seek in our graduates, and we hope that we'll embed in you when you come and do this program. So just how does the program work? Well, this program really starts even before you actually arrive at UCL. Once you're accepted into the program, you'll be given access to online courses. Primers is what we call them. They're designed to help you with study skills, to think about your time management, to also, give you a background. If you come from a business and management background, don't know that much about health, there's a primer in global health. If you're coming from the health space and you don't know much about business, there's an introduction to business health. And then there's also a module on finance and accounting, because often we find that with MBA students, they can struggle with that particular area. So we want to give you as much onboarding as possible so that when you start into your modules, you feel really comfortable with the space and the work that you're going to do. Then prior to the program starting, we have a 2-week induction, and in there is also a 3-day residential where we'll take you off to a different location to help build that sense of belonging. As I said, work with trainers, coaches. That's where you'll work with the recruitment agency to really map out, understand who you are, where you're going, and what we hope you'll get out of this. So it's a tremendous opportunity to really get prepared for this experience. As I said, the program will run in what I call sprints. So of course, the whole program is a marathon, but you're going to do it in sprints. So you'll have that 2-week induction, then you'll have a break, and then during that period, you'll start to prepare for your first block. Those blocks are 30 credit modules that encompass lots of different topics. So you'll have some videos, you'll have online readings, you'll have some exercises that you'll do, some cases that you'll prepare, and then you'll come in for the first block. The first block is called Strategy, People, and Marketing. What does that involve? You have a week of strategy. That week will be taught by a group of professionals. They'll be coming in, they'll be going over the cases with you. They'll be really engaging you about strategy. Then the next week, you'll have human resource management. Again, you'll have experts who will be working with you, going through the material, making sure you understand that in the context. And then a week of marketing. And then the final week is what we call wrap-up week. And each block, each module will have a wrap-up week. And that's where we pool all of that together through having healthcare experts who work in those spaces of strategy, human resources, and marketing, really coming in, working with you in a much more interactive, active way to make sure that you've really gained the competencies that you need and that you can really now apply these skills in the healthcare setting. So as I said, each module, each block is taught by a team, and that team works together. They prepare the materials. They'll have guest speakers, lots of interaction that will take place. Then you've got 2 weeks between the next block to prepare for that. The next one's called Funding, Finance, and Regulation. You'll have a week of corporate finance, a week of accounting and financial reporting, and then a week on health policies and practices. And then again, a wrap-up week. Then in the second term, you have 2 other modules that you'll take. One is called Data-Driven Management. Again, the first week will be around health economics, the second week around data analytics, the third week around sustainability, and then a wrap-up week. And then the fourth block is really exciting. It's contemporary topics in health and healthcare. So you'll have a whole menu of options that you can pick around. You'll take 3 of those options, and then again, you'll have a wrap-up week. Then we also have 2 projects that I'm really excited to tell you about. The first project is called our Global Health Challenge. Now, when you're in your first 2 weeks of induction, we're going to be putting you into a team for this project. This project really runs across the year. You'll be working with other MBAs, and you'll be working with some UCL academics and some industry experts to solve a health problem in a lower middle income country. So you will work on the project, and during term 1, you'll have some workshops. And then in January of the year that you're doing your MBA, you'll have a 2-week field experience, depending on what country you're working on. That's an opportunity for you to travel to that country and have an immersive experience, really interviewing people, learning more about the health system, health practices in that country, as part of the preparation work that you're doing on your project. You'll come back, you'll continue to work on that project. And then in the final term 3, you will finish off the project, which will essentially be a research report as well as a presentation that you'll do for your assessment. So it's an exciting opportunity to really get hands-on experience of global consulting which includes a fieldwork component. Then the second project that you'll work on in your 3rd term is called our Health Consultant Project. As I said, career and career coaching. We'll have a number of career events. We'll have recruiters coming throughout And this will be an opportunity for you with that career coach to really think about how you want to hone in your ambition, and so we are working with a number of industries. So this will be a brief. You may work individually, you may work with a couple of your MBA colleagues, but there will be briefs from industry to do a consultancy project. And that consultancy project will then be your deliverable that you will be assessed on. So we are working with companies now to define that and to get those briefs right for you. And ideally, you'd want to do this in an area that you'd want to go out and work with. So we'll be working with hospitals, non-government organizations, charities, as well as private health organizations to come up with a basket of consultancy opportunities to help you hone in your skills as an MBA. So, as I've already said, this is really an MBA for a very diverse group of people. You can be a manager, you can be a clinician, you can be somebody who's really looking to a business specialist or a medical consultant. You don't need to have experience in healthcare management or leadership, but if you do and you're aiming for accelerating your career, that's great as well. But it's also for people who want to pivot into health and healthcare or take their career into a new direction through an MBA. So really, it's about individuals who really want to make a difference in healthcare and health and pivot their career into doing something very exciting, who want to be creative, entrepreneurial, and really make a difference. So I want to now just talk a little bit about the entry criteria. And so you do need to have a UK minimum of an upper 2.1 or overseas qualification. But also, if you're a graduate without those relevant classifications, but can demonstrate enough work experience you can be considered on an individual basis. In terms of the language requirement, you need to have an IELTS of a 6.5 or above, and no less than 6 in any of the sub texts. And then in terms of work experience, preferably we'd like you to have 3 years of postgraduate professional experience. But if you've done such a degree that you've had work experience alongside it, and you can evidence work experience and the quality of that work experience, we'll consider your application as well. And then we need you to take a GMAT or a GRE score. And I'm going to talk just a little more about that. And we're looking really for a well-balanced score there. And a well-balanced score would be around 600 on the GMAT. And then you have an interview that you'll get after you've submitted your application. All candidates get an interview. And then last but not least, you'll have to submit 2 references, ideally 1 academic and then maybe 1 professional, and then also your personal statement. And the personal statements are going to be really important for us. We're looking for people who want to really make a difference, who have the potential and the ambition to really pivot or continue in health and healthcare management. So that personal statement is so important because that gives us an opportunity to know you as a person, and to see why and you would make a difference as we build the class. So I just wanted to say something about the GMAT exam, because sometimes I have students who are very concerned, and I know that we still live in a period with COVID. The GMAT can be taken online. There are many opportunities and places where you can go and get more practice. There's lots of free exams. So I really highly recommend that you go on some of these sites. You can also take some practice exams. My experience is the best way to prepare for the GMAT is just to take practice exams, figure out where you need to improve, and keep taking practice exams. And you can take them online, so you don't have to go to a test center. If there is a test center in your local area and you want to take the GMAT there, you can definitely do that as well. The other thing is, I have students often ask me about the interview. So we put together what are the kind of interview questions that you can anticipate. Tell us about yourself, why an MBA, what makes you an outstanding candidate, what can you contribute to our program? What are you expecting from the program? And that's really important for us. We want to make sure that your expectations align with what we're going to deliver. And then, really, what are your main weaknesses and strengths? And what are your career aspirations? Where do you see yourself in the next kind of 3 to 5 years? So those are really the common questions. And many of these are also things you might think about in terms of putting together your personal statement. So again, just to summarize, career support is something that we really take very seriously, making sure that all of our MBAs are successful, that they go out into the jobs that really, reflect an excellent MBA experience is so integral for us. So throughout, we are really going to be focused on giving you and equipping you, not just with content, but with really the skills, the ability, presentation skills, the ability to really, put your best foot forward in interviews, to be able to put together an excellent CV, to write and craft a great letter, and of course, to make as many contacts and network. And that is really what going on a full-time, face-to-face MBA is really about. It's having that opportunity, not to just meet people in a virtual space, but to really engage with them. And that's where you'll get that acceleration in your career. We're going to be constantly giving you feedback, not just in terms of your academic work, but your performance. Case studies will be very important because case studies allow you to really hone in your analytical skills, but it's also how you present the case. It's how you talk convincingly, how you come up with solutions, and you gain that confidence about having that ability to really have answers, but to have convincing answers that have data and research within them and behind them, but can be delivered in a convincing way to clients and to colleagues. So this is really what the journey on this MBA is about. It's about crafting your career in this health and healthcare space that's so integral, that will make such a huge difference to so many patients and people across the world. More and more health and healthcare will be on prevention and diagnostics. And that requires really forward thinking, horizon scanning. So again, that will be really important to how we keep our program cutting edge and get you to really start to be one of those kind of thinkers, thought leaders who can really own this space and have a career that's very successful. So I just want to now come to talking about scholarships, because I know finance can be such an important decision part of what you do. So I want to tell you that we've got a very special MBA Health Future Impact Leader Scholarship that students from India can apply for. You can get up to £15,000 through this scholarship. It's offered through the Global Business School for Health, and it's for applicants from low and middle income countries who really want to demonstrate how they can use this MBA to make a difference in their home country. So please check this out. It's on our website, and it's a really great way to get a scholarship that really is also something that demonstrates your potential as a future healthcare management leader. We also have another scholarship that you can apply for. It's called Women Healthcare Leader Scholarship. Again, it's up to $5,000, but more so than just that reduction. And by the way, both of these scholarships would go towards your tuition, to reducing your costs on the program. But this one also, in addition to the $5,000, it's really targeted towards female students who want to demonstrate leadership potential. One of the things that really is worrisome about the health sector was we don't have enough women in leadership positions, and we need many, many more. If we look even in places like the UK, we see that 80% of the workforce is female, but only about 25% of the senior leaders in healthcare are women. And if we go to the United States, we see that, again, it's even less. 20% of senior leaders in health and healthcare are women. And then if we look across the globe, unfortunately, globally, when we add it and average it all together, it's about 5%. And yet women make up most of the workforce. And why is that so important? Because we know from the research that diversity, that by having more inclusion at the top table, we get better decision making, we get better outcomes, we get better healthcare. So we're really committed to this scholarship. It offers female students not only the tuition reduction, but it offers them private mentoring and coaching to really help them along. We hope that through this scholarship and over the next few years of offering this scholarship and working with a group of women to really make a difference, that we can see the outcomes as more and more of our alumni move into top C-suite, level jobs in their careers. So those are two, scholarships I really want to highlight to you. Also at UCL, we've got a number of scholarships. So there's a range of graduate taught funding opportunities. There's also ones that are offered to international students through the Commonwealth, Fulbright, Gray. So please look into all of these. If you go to UCL Scholarship Finder, you'll see what you are eligible for. And again, if you've got any questions, you can always email us or email admissions or scholarships. We're always here at UCL to talk to you. So now I just want to quickly just say, yes, it's going to be a really intense program. You're going to have amazing transformational experience on this program, but you're also going to have a lot of fun being at UCL. UCL is an amazing place to be a student. We have a fantastic student union that has, 250 clubs. We're really hoping that our MBA health students will create an MBA health club. There's also sports clubs that you can get involved in. There's lots of volunteering that you can do. We can also help you with getting volunteering in the health sector and hospitals. And then last but not least, we have a wonderful student support and well-being team at UCL. And if you've got anything you need counseling, we know that wellness and even mental health are becoming more and more important issues for all of us. So we've got great counseling service at UCL. They're there to help you. The student union also has an advice service. And then of course at GBSH, we're here for you. We are really excited at the idea of having this MBA, and we want to make sure that everyone that comes on it has just a fantastic experience. So there'll be lots of opportunities for you to network, receptions to attend, special events, dinners as part of our MBA inaugural cohort. So, and then also I just want to talk about life in East London, because we're very privileged to be able to be part of UCL East. Of course, we're part of bigger UCL and Bloomsbury, and you can move back and forth between our two campuses and locations. But UCL East is a really wonderful place. It's located on the former Olympic Park. There'll be all sorts of opportunities. There's a new student accommodation that's going up there that offers wonderful housing. There's also really good local housing and new facilities. There's, the Westfield shopping mall is just literally on the doorsteps. Lots of places to eat, sports facilities on the park and around the park. So it's just a great place to be. And then moreover, just living in London is fantastic. If you've had the opportunity to do that, you know what a tremendous city it is, and the opportunities for tourism. The parks in London are just amazing, and the green space. And there's constantly things going on, festivals. There's museums that you can visit for free, galleries, institutes. So it's a wonderful place. As you can see, ranked top city for students in the UK in 2021. So it is a fabulous place to be. It's a very inclusive city and a very exciting place to be at this time. So that's really my presentation. It's been wonderful having this opportunity to speak to you. I hope you've enjoyed the presentation and really made you think about coming to the Global Business School of Health. You can check out our website there. I just want to mention we've also got a number of master's degrees, so you might want to look at those as well. But check us out at Global Business School of Health at UCL. And I hope you apply, and I hope you join us in September of 2022.
Thank you, Professor Colton. That presentation was absolutely delightful. So we have a couple of questions coming in. So the first question is, does relevant work experience in healthcare enhance one's chance to get enrolled at the program?
Well, really, we're looking for work experience. And let me tell you why we ask for work experience, because I think sometimes students don't really understand that. It's because people who have worked, and all of you on the line, if you've ever had a job, it really gives you a different perspective on life. And when you then go into the classroom, you learn a lot more. So of course, if you've worked in health or healthcare, that's fantastic. And that would really enhance that. But it doesn't exclude people who come from other work experiences, because there's something about just working. It's about that management and business. And this is an MBA. So if you haven't had experience in a health environment, you're still equally as qualified, because it's really what we're looking for is people who've got that thought process, who know what it's like to have a line manager, who know what it's like to work on as a team and on a group project. They know what it's like to think about problems and solve things and drive things forward in a work setting. So all of those skills will be important. But of course, coming from a health background will give you a different perspective. It will give you a perspective on health. But, health is so wide, as I just said. It's not one, so you might have worked in a tech company, but done something with health. You might worked in pharma and done something with health. You might have worked in the hospital and done something with health. So it's really varied. So I think, it's the whole package we're looking for, Ria. We're looking for people who really want to do this, have the motivation, and can demonstrate all of those things. And yes, so having varied work experience is wonderful.
Right. And I just guess to add one more question to that, say, for example, an applicant does not really meet the basic entry grade requirement. Do you reckon that work experience would help mitigate that factor?
Yes. So I think, again, we're going to look at each applicant as an individual. So there's no reason to require, all of those things, including an interview, if we're just going to pick out one criteria as go. This is an MBA. So, we are looking for a package. We're looking for the whole person. That's why we, again, students don't often understand. That's why we have all of these. Of course, we want everyone to hit the bar, but if there is a compelling reason and you've gone on and you've worked for a number of years and you come with that, we're going to take that into consideration. So I think it's about really giving us a snapshot of who you are right at this moment and why you want to do this MBA. And that is really important. And again, if you're not quite there on the grade point average, but you've got a good GMAT score, that will also help tremendously.
Right. Okay. Thank you very much. And somebody has a question about GMAT, actually. So the question is, well, you answered this. It was how much score is required for GMAT, and that would be 600, right? But I guess to slightly modify that question, if a student scores below 600 on their GMAT, is that something that is desirable or not? Or what would you say?
Well, as I said, 600 is just kind of a benchmark. So you can be down below 600 a bit, and you can be up above 600 a bit. But you should be around that area. So if you're a lot if you're way off 600, that would not be a good sign. So you can take the GMAT more than once. I would really highly recommend that it's all about practice. If you've got the background, so, take the GMAT again and get your score as close to 600 as possible. We're looking for a balanced score, but it is an important variable in terms of thinking about your readiness for the program. So, it needs to be in that range. It doesn't have to be 6 on. And of course, if you're above 6, that's fantastic. And if you're a little bit below, that's okay as well. We're looking for a balanced score. We're looking for people that can show those competencies. And again, why do we do that? Because people come from different schools and different universities and different backgrounds. And we want to be able not to think about rankings of other universities, but think about you again as an individual and your readiness to do the program. So the GMAT gives us a kind of a equal playing field, as it were, to look at our candidates.
Right. Okay, great. And the next question is, how many years of work experience would you ideally be considering for this course? And what type of work experience are you specifically looking?
Yeah, so we'd be looking for, around 2-3 years minimum, and ideally 5 years if you've had that kind of experience, recognizing that most of the people that do in-person MBA are people who are early in their careers. But we would expect you to have, kind of experiences that would require kind of a bachelor's degree or above. So, so the reason we couch that a bit is sometimes people in the medicine area, they get their first degree and then they are training, they're still training, but they have that kind of equivalency already from having done that first degree. So I think it's, when you're thinking about your work experience, and it can be, by the way, many people, who apply for MBAs, they come from family-owned businesses, and they have been doing a lot of decision-making work. So it's looking for that kind of equivalence. So, if you've been clerking, that wouldn't be kind of MBA work experience that we'd be looking for, in the sense of, if I was cash register, or working in a shop like that. But if I was a manager in a shop, and making kind of decisions. So that's why we say post, kind of post-grad experience is experience that would be at or above an undergraduate level. Does that make sense, Ria?
Yeah, no, that makes perfect sense. Yeah, it makes a lot of sense. And it answers all the questions that were asked about this. And the next question that we have is, so the student has completed their MBBS. If I do MBA healthcare, what kind of job opportunities would be available?
Yeah, so that's a really good question. And again, that's would be a great background as well for coming in on this program. The kinds of opportunities would be to really use it to maybe, as I've already said, go into management consulting in the healthcare space. You could go into hospital administration, a leadership role. It could be some sort of clinical director role. So it's really, and also lots of people with medical backgrounds, by the way, use MBAs like this to really go into private practice, to really, expand their GP practices as well. And to professionalize them in a way they might not have thought about previously. So I think there's lots of opportunities. And then, there's just a wide spectrum. And one of the things that we'll be doing when students are on this program is really exposing them to lots of different professionals that have these jobs, who've taken degrees like that, done an MBA, and then really pivoted into, say, pharma, biotech, pharmaceutical management. Because, I have a alum, just to give you an example, who's, has that background. And he now is working for GSK, which is a large pharmaceutical company. He has a great job. So, it's taking it and moving into those kinds of jobs as well. So really, it's about opening your horizon. And I think sometimes people, when they think about health and healthcare, they think really narrow, they think about like public health, and they don't begin to understand that it's a brand new world. There's so many opportunities here that you could take it into. So it's really, I throw that question back at the person who asked it and say, where do you want to go with this? Think out of the box. What would you like to be doing in your next job?
Yeah, that makes a lot of sense. That's really, that makes a lot of sense. I think the next question that we have is, can MBA healthcare improve my chances to work with an organization like WHO, especially in terms of the work visa that international students require?
Yeah, so, as you might know, I'm sure you know, Ria, students that do this program will qualify instantly for, they can go on and do a post-study work. So if you want to stay up to 2 years in the UK, you can do that after you finish this MBA. And of course, that might lead on to something much bigger and longer if that's your aspiration. For international organizations, I can assure you, having a degree, like this, it is really, I cannot emphasize enough how health and healthcare are changing. And that recognition, we just had an article that we were featured in the Financial Times this week that I'd be happy to share with you. And really, there is an awakening, that, public health isn't, needs to come together with business management. And so that idea, and even with, going into these kind of global governance organizations like the WHO and others, that professionalization, that ability to understand. I mean, if we think about the pandemic, one of the biggest things that it's exposed is supply chain management problems. Okay, well, those really take a skill set, an understanding of operations, strategy, supply chain logistics. Those all sit in a school like ours. And so I think, yes, I would say absolutely, this kind of background, this training that you will get will really tee you off for working in a number of organizations. And it makes you stand out a bit because it is very, very novel.
Right, I understand. And one last question that we have is, if an applicant does not have work experience in this field, would you still be willing to consider them if they've done, say, for example, internship or volunteering experiences?
Again, we would, but they need to really be able to tell their story, and this is, I had a young man come to me who's got, again, why I mentioned it earlier, a family business. He's worked in his family business, alongside his father his whole career. He was able to really craft a personal statement that really demonstrated just the wealth of experience he's got. So again, if you've done volunteering, if you've got internships, if you can really craft those in a way to demonstrate, because that's what we're looking for. As I said a minute ago, it's not about length, it's quality of experience. So, it's, what were you doing? What were the tasks? How did it shape your thinking? How did it really, create your sense of understanding of the workplace? And sometimes internships can be great because you're shadowing and you're seeing how an organization works. You're getting insights, both as someone working inside the organization and someone observing the organization. So, but it's up to you to really shape that in your personal statement and in your CV that you'll submit with your application. And that will resonate with us. we're looking really to build a class of people who can really come in. So yes, I wouldn't shy away if that's the kind of work experience, but it is getting that word right, and really crafting that personal statement.
Right, right. And one last question. So you mentioned personal statement quite a bit in detail. And what would be like a couple of quick pointers you would have in terms of the factors that you're looking for, the elements you're looking for in an SOP, in a personal statement?
Yeah. So first of all, I'm really happy you asked me that question, because I have to say, I see a lot of bad personal statements, and I'm going to tell you what the difference really is. This has to be authentic. This has to be you. So even if you go out and have someone help you a bit with your personal statement, there's a reason it's called personal statement. So it has to really reflect you. So I always say to, and I often help, people with personal statements to really think about what is it that we would value. Well, one thing is being a team player, being a leader. So part of it is, how will you also contribute to being part of this cohort? This is, yes, of course, I've talked a lot about all the benefits to you as an individual, but it's also, how will you fit into this class of MBA graduates? So that's one thing, that's one tip, because I noticed that sometimes students tend to turn it into a CV. The personal statement is not your CV. You can submit your CV. The personal statement needs to be crafted very differently than your CV. So in the first CV, you list everything that you've done. In your personal statement, I want to know how you're thinking. So you need to reflect. So one thing is, I'm going to be looking for, students who, understand the program, understand the opportunity that's here, and have the ambition. So how has your journey through life? So tell me a little more about yourself, and really ask yourself, why do I want to do this program? So that's going to be number one. Why do you want to do the program? That needs to come through in your personal statement. Then what is it about you that makes you a good candidate for this program? And, and part of that is also, if we think about, this is really, and then three, where do you see yourself going? Those three questions are really important in such an essay, is, the why, the what, and the how. And, really thinking through your experiences up to this point and how they shape your thinking. So, as I said, don't just repeat in a very methodical way, what you've got on your CV. Give me you. I want to know you as a person. What is it that you want out of this program? How do you see yourself qualified? What have been your life experiences? And they have to be authentic. So the other thing is, there's no reason, it doesn't have to be dramatic. It has to be informative, and so if I go back to, rather than listing, I've done this, I've volunteered here, I volunteered there, you would say, when I was, what was it about those experiences? So when I was volunteering in the hospital and I saw how, overwhelmed the health professionals were, and I saw how the, pathways that patients were being put on and the way they were being triaged was so inefficient. And it really made me realize that I wanted to get in there and make a difference, that I wanted to help design something different. So it could be something as simple as that. And then, that's how I would go about it. So try to be authentic. Don't turn it into your CV. Pick out a few things from your CV that really you feel capture who you are. and then reflect on those and unbundle them. But make sure too that it then takes you back. So you start out, why do you want to do this program? Then you bring in your experiences and how they've shaped your thinking. And then at the end, what would you like out of it? What are your expectations of where you're going? And those kind of 3 points, and it doesn't need to be more than just a couple pages. Then the other thing that I have to mention is language is important. If you write it and the sentences are poorly constructed, and it's going to put the reader off immediately. So, there's lots of software now out there. I don't want to endorse anyone software, but, I've never understood why, Grammarly or some of these softwares that will really check your grammar, your sentence structure, this needs to be polished. It says a lot about a candidate who sends in a personal statement that's poorly written, that doesn't, so please, if you're going to apply, make sure that you either have someone edit it or that you yourself edit it, but make sure that your language, that it's crafted in a way that the reader isn't distracted by poor grammar, but can focus really on the content, on you and your ambition.
Thank you very much. That was very, very informative, a very informative answer on personal statement. That was incredible. The last question that we have is, what's the salary expectation that international students can expect in the healthcare industry?
So it's such a big question because it's all over the place. It's really up to you. As I said, and again, Ria, I'd be happy to share with you, there's an article that was recently published about just healthcare salaries. It will depend on what country you work in. It will depend if you go into public health, private health, so consultancy. Of course, there are certain areas where the salaries are extremely high. If you go into management consulting, or you go into a more private health job, you're going to make a much higher salary. If you go into a more public sector job, you're going to make a slightly lower salary, but you might have a trade-off. Your lifestyle might be different. Your satisfaction and fulfillment might be different. So it's not all about money, but it will vary. It just, so there isn't one answer that I can give you. I can tell you that it could be up to 150,000 pounds, and it could be around 60,000 pounds, and anything in between there. But there are huge opportunities, and nowadays people often have a portfolio career as well. I see a lot of people start out in public health, or and then move over into consultancy. So this will really tee you off to lots of opportunities, and I think it's really up to you then to decide what you value most and how you value it.
Right. And I believe that's all the questions we have. We don't have any more questions coming in. Okay, so that's all we have. Right.
All right. Well, thank you so much. And thank you for giving me this opportunity. I'm really excited about this school and this program. So I hope that, some of the listeners, apply.
Yes, thank you so much, Professor Colton. We thank you for your time. I feel pretty convinced that this program is pretty fantastic. I'm like, maybe I shouldn't have done law. Maybe I should have done healthcare or something. So
you can always switch. You can always come back. We're waiting for you, Ria.
Yeah, I have to consider. I might actually submit my application. All right. Thank you so much for your time. And I hope everybody has a great day. Bye. Take care.
All right. Thank you. Bye.